help us understand more of what exactly unfolded on that field is cardiologist Dr. David Landers from Hackensack University Medical Center. So, doctor, good morning to you, and thank you for being here this morning to talk more about this.
Good morning.
So, doctor, let's talk about first and foremost what we saw on the field play out. You know, you're the cardiologist. You know about these heart issues, right? And I don't want to say too much because we haven't gotten an official diagnosis, but how rare of an injury is this that you saw play out?
Based upon what we know so far and what is evident from the video images is that this is a rare event whereby a blunt trauma injury to the chest results in chaotic rhythm of the heart. Very rare, about 20 to 30 cases per year in the United States.
Yeah, you know, we've heard about instances similar to this with either amateur baseball players. We've also even heard of young kids, you know, just playing ball in the front yard that have been hit in the chest with the ball and have gone into cardiac arrest. Is this the same type of injury?
It is the same type of injury. Indeed, that figure of 20 to 30% generally results of an injury occurring in youth sports, typically teenagers. 50% are from youth sports, about 25% from just recreation in the yard, and another 25% from actual fighting or brawling that might take between individuals. So it's a small number of cases, and not really that common in professional sports.
Yeah, I mean, and when you look at the play, it was very standard tackle that we saw kind of play out on the field. So when you look at it, does an injury like this mean that someone may have a pre-existing condition, or is it really just the hit was at the exact time that caused a perfect storm of circumstances?
The latter is more likely, although somewhat perplexingly, when patients have sudden cardiac death, there's a whole range of possibilities as to why that may have occurred. Some can be identified with subsequent cardiac workup, and others remain a bit of a mystery. But this particular, in a professional football player who most certainly has had extensive screening of his heart, the likelihood that this was a normal heart in which there was just that impact at that one particular vulnerable period resulting in rhythm.
Yeah, it's scary to think you could be a perfectly healthy person and have this happen to you. So Damar's uncle yesterday said he is breathing on the ventilator. It went from 100% on Monday to 50% yesterday. So how important is that? What would you say is the prognosis? It looks positive?
Well, certainly that's a good turn of events. That's an important finding to see that the requirements for the ventilator are decreasing. Certainly that's it's a little difficult to give a prognostic judgment based upon what we actually know about the case at the moment, but that's certainly a positive.
All right, Dr. David Landers from Hackensack University Medical Center. We appreciate you being here, giving us more insight to what exactly is going on here. I appreciate your time.
My pleasure. Thank you.